In most healthcare settings worldwide, there are strict frameworks in place regulating the use of chemotherapy drugs like vincristine. These include prohibitions against storing such drugs in a fridge with other medicines and giving them in conjunction with other therapies. In many countries, there are also regulations specifying that a registered chemotherapy nurse must be present during the procedure and that the treatment must be given in a special room or bay. These types of frameworks and regulations are known as standard operating procedures or guidelines. These standard operating procedures and guidelines apply widely and are not specific to the use of drugs like vincristine. For example, well known are the Advanced Trauma Life Support Guidelines from the American College of Surgeons and the World Health Organization's Pain Ladder for safe and effective administration of opiate analgesia. In the film we have just seen, you should clearly note that the standard operating procedures and guidelines were not adhered to.
Yes, it's about Mrs. Jane Hughes.
I've seen this prescription for...
methotrexate you sent down?
You've already got her down for her IV this morning.
And I've only sent her vincristine up.
The methotrexate should not have been dispensed on the same day as vincristine. A mix-up of these two drugs could lead to fatal consequences, and a protocol was in place to prevent this. Had it been adhered to, the error may have been avoided.
Okay then, look, I'll prepare it for this afternoon.
Factors that may have led to the pharmacist breaking the protocol are many and varied. They include the pressure of work and a hierarchical management structure which does not encourage constructive questioning of the doctor in charge.
I'm going to pick up the chemotherapy for Mrs. Jane Hughes, intrathecal methotrexate.
Dr. Campbell should not have been allowed to administer chemotherapy.
I don't seem to have you down.
He was not confirmed as having the skills to do this. Despite this, the nurse was persuaded to allow him to practice on the ward, and the pharmacist allowed him to pick up the prescription. A system was in place, but not adhered to.
Here we are, Doctor. Methotrexate, 2 milligrams in 2 minutes.
Sadly, in many areas of healthcare, when these procedures are in place, their purpose is often misunderstood, and they may even be treated with contempt. Lack of organisational leadership, poor communication, high workloads, and inadequate education and training all contribute to the lack of adherence. Actually, standard operating procedures and guidelines can be a great protection against error. Their objective is to make patients and practitioners as safe as possible each and every time that a procedure or action is undertaken. Standard operating procedures do not destroy clinical autonomy or decision-making. Rather, they provide an evidence-based, agreed framework for protecting patients against error. Wherever possible, they standardise the procedures in place so that everyone understands their role and what is expected of them. Where standard operating procedures and guidelines are present, they must be adhered to. Where they are not in place, appropriate measures should be taken to establish them. We need to make sure we have an organisation-wide view of standard operating procedures and guidelines, so these essential components of safe care do not fall by the wayside. We need to see such procedures as the hallmark of professionalism and good patient care, rather than as an enemy. When standard operating procedures and guidelines are present, we need strong and visible leadership to ensure they are adhered to. For your organisation, ask yourself the following questions. Could standard operating procedures and guidelines be put in place to make delivery of care safer? Are standard operating procedures and guidelines being adhered to? And if not, which pressures prevent their operation? Is there a culture of contempt within your organisation for standard operating procedures and guidelines?